England's health service to stop prescribing puberty blockers to transgender kids. A sign for the National Health Service outside the pharmacy in London. CNN England's the National Health Service called the NHS has stopped prescribing puberty blockers for children and young people with gender dysphoria or gender incongruence, saying there is not enough evidence to support the safety or clinical effectiveness of puberty suppressing hormones. NHS England said it made the decision, which was widely condemned by LGBTQ groups, after it carefully considered an evidence review it commissioned in 2020. It also reviewed the evidence published since then, it said in a policy document published Tuesday. Puberty blockers will now only be available to young people in clinical research trials and some private clinics, UK's PA media reported Tuesday. Fewer than 100 young people are currently on puberty blockers via the NHS, and they will be able to continue the treatment, it added. Puberty blockers will also be available through some private gender identity clinics. According to the According to the NHS clinical policy, treatment for young people focuses on psychosocial and psychological support, gender-affirming hormones, and surgery may be available later or in adulthood. Gender-affirming care for young people in England has faced the legal and political scrutiny in recent years that has coincided with the rising anti-trans rhetoric in the country, say LGBTQ advocates. Some British politicians welcomed the LHS England's announcement. The UK's Health and Social Care Secretary Victoria Atkins said on X that care that affects our children's health and well-being so profoundly must always be based on the clinical evidence. Health Minister Maria Cofield also welcomed the policy, calling it a groundbreaking change as children's safety and well-being are paramount. Stonewall, a LGBTQ campaign group in the UK, criticized the Tuesday's announcement, writing in a statement that all trans young people deserve the access to high-quality, timely health care. For some, an important part of this care comes in the form of puberty blockers, a reversible treatment that delays the onset of puberty, described by expert endocrinologist, giving the young person extra time to evaluate their next steps, it wrote. We are concerned that NHS England will be putting new prescriptions on hold until research protocol is up and running at the end of 2024, the charity added. Mermaid, the charity that supports trans, non-binary, and gender-questioning children and young people, said that NHS announcement is deeply disappointing and further restriction of support offered to trans children and young people through the NHS, which is failing trans youth. Gender-affirming care is medically necessary, evidence-based care that uses the multidisciplinary approach to help the person transition from their assigned gender, the one the person was designated at birth, to their affirmed gender, the gender by which one wanted to be known. Puberty blocking is the non-invasive therapy that can be reversed. Doctors inject the compound or use the implant that mimics the actions of the puberty stimulating hormone that is released in the brain, known as gonadotropin. releasing hormone. The compound makes the pituitary pituitary gland less sensitive to that hormone, and in doing so, it essentially pauses the puberty. Puberty starts again after the drugs are stopped. In the U.S., where several Republican-led states have banned gender-affirmative health care for young people, every major medical association agrees that gender-affirming care is clinically appropriate for children and adults. This includes the American Medical Association, the American Psychiatric Association, and the American Academy of Child and Adolescent Psychiatry. Gender-affirming care can include puberty blockers, which may not be a part of every association's treatment. MAA and the LGBTQ advocates stress that gender-affirming care can be a life-saving treatment for trans youth. In the US, transgender and non-binary youth are twice as likely to have attempted suicide compared to their cisgender peers, according to 2022 survey by the Trevor Project, a suicide prevention and crisis intervention organization for LGBTQ youth.